Hello, everybody. I hope you're having a wonderful day. This is Dr. John Gonzalez from Acadia Women's Health, and I really want to discuss one of the hottest things going on right now in cosmetic surgery, and that's the Brazilian butt lift or liposuction with fat transfer of buttocks. A lot of times I'll get asked, which one do I really need? Do I need a Brazilian butt lift or fat transfer, or do I need a butt implant? And the truth is, most people, if you have sufficient fat, and most of us have enough fat for a fat transfer, we'll go ahead and have the fat transfer. We know it's a lot safer. It's your own body part. It's your own body tissue rather, so it's going to be accepted really easily. It has a very low risk of complications. That's different than butt implants, and we kind of tend to think, well, butt implants and breast implants, we do so many breast implants and they do fine. Why don't we just do a whole bunch more butt implants? And the reason is those seem to be associated with a lot more risks and a lot more complications. And there's a few reasons that I could think of. So one reason is a butt implant may be a bigger issue is, number one, that's a weight-dependent part of our body, which means when we're sitting down, we're actually putting pressure on that implant. We're putting pressure on the incision that where we place the implant. And technically, even though most of us are very clean and we take good care of ourselves, that part of the body just tends to harbor more bacteria and has a higher infection rate. And whenever you put bacteria really close to a foreign body, like a butt implant, the infection rate really can go off the roof. So butt implants are something we generally do not do, and actually you'll probably have a difficult time finding anybody who does them, because most of the time we know that most people are good candidates for fat transfer, and because that's a lot safer alternative as opposed to breast implants. And breast implants, we do lots of them. The safety profile's been out for 20, 30, 40 years probably at this point, and we know that they're very well tolerated. And what we said about a fat transfer. Fat transfer is where we liposuction a certain part of the body, and we take that and we fat transfer it to the buttocks. So liposuction recovery, if we weren't doing a fat transfer, for most people is just a few days. Like, for example, I took 2 or 3 days off of work before coming back. I wasn't on any more pain medicines. I was a little bit sore, but because I operated every day, all I would take was Tylenol. And I find most people have a similar recovery time. If we're talking fat transfer, it's a little bit different. There's a little more discomfort involved. And the biggest issue with the fat transfer is we recommend that you not sit down directly on your buttocks for the first 3 weeks, because we know that if you do, we may displace some of the fatty tissue that we put in certain parts of our butt, and then also we may lose some of that fatty tissue because we've compromised some of the blood supply. So the biggest issue after BBL isn't really so much recovery as far as pain and discomfort, but it's more of an issue of being careful not to sit, and that's why we recommend a lot of people buy some things that are on the market. You can check on Amazon. One of them is called the BBL pillow, where you mainly sit and put all the pressure on your upper thighs, and it allows your buttocks to really not have that same pressure while you're sitting. So I hope this helps and gives you some good information. I hope to see you soon.